Hi, doctor. So we heard that you were speaking at the AI in Healthcare Summit on Rise National, the webinar, and we wanted to know what exactly uh, did you guys discuss? So what was the theme, and also around your topic, implementing adaptation, why data management is critical, and if you can give us an overview on the operational side regarding AI. So,
Yeah, no, happy to. It was their inaugural summit, and so it was virtual, and it's 2 days. So I got to chair the first day, which was yesterday, and then today is the second day of the agenda. I thought it was a great conference, well attended, and the content was phenomenal. And so in that first day, the beginning part of the agenda, I really think, was around getting to know AI. In fact, the keynote that opened talked about the difference between hype and reality. And I think for our industry, it's important to recognize the differences between, say, large language models and they talked about the differences between large language models and AI, what the abilities are, the different types of AI. And I think that as folks in the industry, it's important to recognize what those capabilities are. Now, the content wasn't specific to value-based care, which is, what I have an ear to. I mean, they did talk about things like CDI and how AI can help improve those things. But there was a lot around too, just improving imaging. I know that a lot of us are familiar with patient reminders, being able to connect teams and share data, being able to get consults. So there was a lot into the clinical side of medicine and how AI may help, some into the operational side of medicine and how AI can help. And so I thought, thus far the content has been phenomenal. A lot of new speakers, a lot of clinical speakers too, which I always enjoy, as well as AI experts. So it was really nice to get to hear those new voices and glean and, get to benefit from all that expertise. And then I was lucky enough to have a session. My session really focused on data management and fully disclosed that I'm not an AI expert, but I think that there are some basic best practices that one can employ. And so the first part of the presentation, we talked about quality of data. So how do you ensure that the data that you're looking at actually has, some fidelity, and what are best practices? And so I talked about the importance of governance, who's accessing your data, what are they doing with it, for what purpose, what can we know by the data that we have? Do we have enough data, or not enough data? Are there any particulars to that data that might influence the story, that that data is telling? And that was one of the things too that a few of the doctors talked about. And I think it would be, I know that they talked about it as hallucinations, but where, if you don't consider the quality of data and the type of data that you have and what it can say and tell, your AI may not necessarily be effective. And so having a lens to that, don't think that, just because apply AI to something that all the results are going to be perfect, that you still need to mind that. And so I talked about what you need to do to have a good quality program. I talked about some of the challenges that we find in data and some of those that I enumerated. And I shared examples from my time as a leader, things that I've experienced where, teams moving quickly, maybe we needed to do some additional QA, didn't, right? What happened there and what some of the repercussions might be, what the exposure is, how you might deal with that. And so spent some time talking about that. And then moved into talking about data and the necessary requirements. So things like what I was mentioning before, timeliness, knowing if your data is coming from a particular geography, what it can tell you. And then I think the largest lesson that I wanted folks to come away, at least from my presentation, was that there's always bias. I know I've shared I'm a professor as well. and I chair and advise doctoral students on their dissertation, both qualitative and quantitative methods. And one of the things that we recognize that's very much, postmodern theory is that the researcher is not the source of authority, nor can they know everything. And so recognizing that when you're using AI or looking at any data, there's always inherent bias. And so it's going to be limited in what it can tell you. And that you need to, have an understanding of that, be thoughtful about that. One of the gentlemen had shared, one of the other speakers had talked about, if you took your model and you moved it to another country, it may not work, right? Or vice versa. And so just, recognizing all the different variables that can influence, what you're producing. And so I thought that was really important. There were a few questions. So one of the questions that I think that's been on a lot of people's mind, especially when when Chat GPT came out, was whether or not it was going to replace people. And just a couple of things, and this was a message that was prevalent in the conference too, was that AI has been around for a long time, and Chat GPT is not AI alone. And I think all of us that have used Chat GPT, my 14-year-old son included, that tries to use it to do his homework, that it's not the be all end all. And so again, going back to that message that I was saying, that you really need to think about what's being pulled forward and is it really reflective of what it is that you want to say in the messaging. And so I would have that in mind when thinking about the answer to that question of whether or not AI is going to replace people. And the resounding message throughout the conference was no. It's not that some mundane jobs might not be replaced. They definitely could be, and machines are getting smarter and smarter. That was another theme of the day too, is that AI continues to get better and better, and even to the point where, we now have robots in long-term care facilities that can provide, emotional response. There are still some limits, obviously, but anyway. As far as replacing people, it wasn't that. Maybe the more mundane task, but what it did is it elevated. It allowed people to really focus on what they do best, what machines can't do, and really freed them up to be able to provide that focus. And so when I think about healthcare and I think about our physicians, rather than, and there was some representation, quite a bit of representation actually by radiology, but I think they're probably maybe one of the more prolific users of AI, and that's the reading of images. And so if you have, AI reading through images and able to identify anomalies, uh, how much better that is, that you could process that imaging that much more quickly and respond, right, and provide patient care, only needing the physician to come in and validate the findings. So a lot of the conference focused on that. Like I said, it was pretty exciting to hear about the different organizations, different areas of medicine and of healthcare that are using AI, and then also to where folks were on the continuum. There's definitely a difference in maturity across organizations, but I think that regardless, whether or not you've been using AI for some time and feel that you're particularly savvy and have a full, data plan, that there's still opportunity and there's a lot more to come. And so while this was the inaugural conference, and it was virtual, I fully expect it to continue to grow. Like I said, I was really impressed to see the attendance and that folks hung with it all day. That can be difficult to do in a virtual conference, and look forward to subsequent years, and for the conversation and the content to continue to develop.
Thank you so much for sharing your experience, Doctor. And you are absolutely right. I also agree with the fact that I think that there's a lot in these conferences to grow upon. I just have one question though. You said that, could you please share some insights about this conference regarding the presentation by maybe the clinical speakers? You said that you attended their session as well. What were the key points that were discussed regarding how AI can assist in clinical settings?
Yes. Again, it was a lot of talk around bringing data together. We talked about structured data, unstructured data, the need for how you would apply, I want to be careful because I don't want to say everything was about meta tags. It wasn't. And I know that there's other ways to interpret unstructured data, but talk about bringing data together so that you could provide better patient care. And so AI, permits that. Um, it's reading over the various data elements, potentially disparate data, bringing those pieces together, standardizing it in a way. There's a lot of thought and discussion around how do you bring information together. And I think of it like reading a novel. I could read a novel today, and if I read it 2 years from now, it might have different meaning for me, and so on and so forth, depending on the lens, right, of my life and what I apply. And so I would say that same analogy works for AI too, that depending on what you pull forward and how you pull forward and how you write the script depends on not only how cogent the story is, but the flavor of that story. And so there was some discussion around that, and being, thoughtful about how you're applying AI in that way. But then again, to what I was saying about, I think radiology has been one of the larger users. And so using that to be able to scan imaging, um, we talked about too, just even using AI to interact with patients, to shape patient behavior in some ways. I talked about that some in my presentation, that, when we think about healthcare, there's really three actors. I don't care what it is, if we're talking about AI or, something else, but I think there's really three levers that one can push on in value-based care. And so tools and technology, right? AI is a part of that, but AI can also be used to improve the existing tools and technology that we have. But then also to providers and how they might change their behavior and the delivery of their behavior, and then patients. We need patients to be engaged. And so AI is another vehicle that can have influence over all three of those pieces. And so there was some talk specific to that.